We've been telling you that pregnant women, healthcare workers, and children are going to be the priority for swine flu vaccinations this fall. Well, today we know just how many people that will affect. In total, the top priority group is about 160 million people. The CDC also says that that number of swine flu cases, yep, we expect it to increase when school starts. I don't think this is a great secret, but expect those increases to start probably in August when schools get back from recess. And the problem will be at that time that there's going to be a lag between when school gets back and when vaccine will be ready. Vaccine probably not ready until October. In fact, the CDC says that the vaccine will be ready. They guarantee, at least verbally right now, by October. Some doses were released yesterday, hoping to have 120 million doses out by mid-fall. But not everyone is so sure that taking a brand new vaccine is a good idea. With me now to talk just about this, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, and Diane Miller, the director and lawyer for the National Health Freedom Coalition, and she's also with pandemicfluonline.com. Diane, since you're new to the program, I'm going to give you the first at bat. What is your concern?
Well, our major focus is to get accurate information to consumers and make sure that they have a choice when they're going to get the shot. We don't want any parents to...
Are you worried about the mandate then? That someone's going to make you get a shot?
There are concerns about mandates because of the health emergency laws, the jurisdictions of states and federal governments.
Dr. Fauci, would you mandate a vaccine?
No, there's not going to be mandating. There's going to be recommendations of people to get vaccinated, and there are prioritizations that we heard yesterday from the Advisory Committee on Immunization Practices, the ones that you just mentioned, Nancy.
So I know one of the things that's going to come up will be getting reliable data as we start ramping up vaccine production. How will you, as a federal agency, start to figure out what's safe and what works?
Well, Nancy, first of all, you have to understand that the vaccine that is soon to go into testing in the second week in August and is under production right now are vaccines that are strikingly similar to the vaccines that have been given every year for decades as seasonal flus. So we have experience with millions and millions of people who've received similar vaccines made by the same manufacturers, the same processes, the same type of vaccine. We're talking about a strain change here, and the safety record for those are extraordinarily good. Having said that, because we're going to be injecting people with a vaccine that has a newness to it, we are going to do safety data, but we also want to know whether the right dose is. You don't want to vaccinate somebody and not have the correct dose because you want to make sure that you have a dose that will induce a response that you would predict would be protective. So we're going to be getting both safety and what the right dose type of data are superimposed upon a long history of safety with very similar vaccines.
Diane, listening to Dr. Fauci, does it make you feel more comfortable with the fact that the government's on board?
No, actually, our website is giving the consumers the data that the lack of efficacy and the very well-documented dangers of the vaccine adjuvants.
But Diane, how do you know about efficacy when it's being tested right now and it's not even available to the public?
Right. Well, they're basing what the doctor just said is they're basing it on past history. So we're looking at past history, looking at the different studies that show that it's not effective. And then, in addition, we're giving the consumers the information that they need to make a choice about what kind of dangers they want to take on for neurotoxins and arthritic and autoimmune responses to adjuvants within the vaccines. And for some reason, the American public is becoming more and more critically thinking, and they're wanting the information, and we're giving it to them without a middle person in mind.
Dr. Fauci?
Yeah, Nancy, first of all, the word adjuvant has been mentioned 2 or 3 times in the last minute. What we're talking about right now are non-adjuvanted vaccines. We're talking about vaccines that have been given to the American public during influenza seasons, as I mentioned, for decades with a good safety record. We will be doing, after we do the non-adjuvanted trials, a trial on determining the safety and right dose of an adjuvant. We are not talking about giving adjuvanted vaccines to children, for sure, and the adjuvant situation in Europe has a very good safety record. But she mentioned adjuvant. adjuvant, but what we've been talking about, what the department has been talking about, is not adjuvanted vaccines.
And Tony, just so we know that everyone else understands what we're talking about, explain an adjuvant.
Yeah, an adjuvant is a substance that is given together with a vaccine that does a few things. It enhances the immune response. It could lead to what we call dose sparing, to get a comparable response at a much lower dose, as well as the fact that it broadens the scope of the response so that you could probably get some good responses against viruses that are drifting away from the original virus. So there's some advantages to that. The Europeans use it. They've been using it for years, particularly in elderly individuals. But again, I want to emphasize to the audience, you don't want to mix apples and oranges here. What we're talking about, the trials that will start in August, and what we're talking about, what we're going to be, if we make the decision to do this, given to children and others, is that they're non-adjuvanted vaccines. So I don't want the people to get confused about that.
And because on that note, we are going to end this conversation today, but I look forward to talking to both of you as this develops, because obviously we know with school just a couple of weeks away, we are going to continue to follow swine flu developments and the vaccine for H1N1. Diane Miller, Dr. Tony Fauci, thanks so much.